Hi, my name is Brujic, and I gave a course on ocular toxicities, and it's specifically focused around antibody drug conjugates, which is a new category of medications that are being utilized as infusions for patients who have certain forms of cancer. And really, what these antibody drug conjugates do is they're intended to be more specific for the target tissues. So there's antibodies that are specific for the antigen on these target tissues, and they actually have a payload attached to the back end of these antibodies. So in theory, what should be happening is they should be hyperspecific for these cells, and they should be entering these cells at a higher specificity, which for the most part they do. The interesting thing is there's these ocular side effects that have started to emerge from some of these therapies. And the ocular side effects can lead to these microcystic epithelial changes that occur. It can lead to some corneal staining. It can lead to some refractive shifts. So during this hour, we talked about what the optometrist, the eye care provider's role is in helping care for these patients and really kind of co-managing them with the oncologists who are caring for the individual's cancer.
So, what are some symptoms that should prompt an eye care provider to ask a patient about receiving ADC therapy, or if they're receiving it, or what would that look like?
It's such a good question. And the good news is that these patients will usually be pre-specified and pre-identified because any oncologist that's caring for these individuals, there's actually a black box warning on the treatment for these entities. So they have to have their eyes examined prior to the first treatment. And then they need to be followed every 6 weeks for the first 6 months. So we'll know that they're coming into the office and they're going to be starting this treatment or therapy. The key is that we as optometry need to make sure that we're sharing with these individuals if you are experiencing any changes in your vision or any issues with your eyes in between those 6 week time periods or intervals, making sure that they come in sooner and making sure that they share those symptoms with us, because oftentimes these patients on antibody drug conjugates, this is kind of a last form of treatment for certain cancers. So sometimes they'll try to mask some of their symptoms in order to continue receiving the treatments because they feel that if they have any issues, that may pull treatment from them. So we need to be cognizant of that fact and make sure that they are comfortable sharing symptoms with us if they do have them. Because the good news is we can care for these patients if they do have symptoms that show up.
Seeing that follow-up is so regimented for these patients, what does effective communication between the oncology team and eye care providers look like? Like, what looks successful in that scenario?
Every time we see these patients, we always do a summary. And the good news is there's forms that you can get online. We showed this directly through the course where you can actually click on a QR code and it can get you right to the website. But it really shows what the vision is and what the status of the ocular surface is. And making sure that every time you see these patients, you're sending that form to the oncologist is critically important.
What would you say are some educational gaps that remain in eye care broadly regarding these cancer therapies and the effects?
Yeah, well, I think the biggest thing is one, establishing what the protocols are. And really, they're very specified. So one day before infusion, a patient starts on a corticosteroid drop 6 times a day for 4 days. And then they do that same corticosteroid drop, but 4 times a day for 4 days. So every time they start an infusion, they're doing an 8-day course of corticosteroids starting one day before the infusion. And these infusions are done approximately every 3 weeks. So every 3 weeks, these patients are going on a corticosteroid pulse. We need to make sure that we're prescribing that appropriately for patients and that they're educated appropriately, because this regimen will help mitigate some of the symptoms that we see with these individuals.
Anything else on that particular talk that we didn't touch on?
I just think it's critically important for us as the eye care community to understand this, because we will see these patients in our practice, and there's a whole slew of medications in this whole category of antibody drug conjugates that we're going to start to see more so. So we need to understand what those ocular side effects are and what those treatment protocols are for those patients from an eye care standpoint perspective, and also making sure we're actively communicating with the oncologists.